Hello, welcome. Today I'm talking to you about what it takes for you to be able to study medicine as a course, or what you need to know for you to become a medical doctor. What you need to know for you to become a medical doctor. I was somewhere yesterday and the father of the child I went to see a man and the son was with him in the office. And the son came, he called the son's name, and I asked him, what is the meaning of the name? They took out time to explain to me how the name originated and how he shortened it, called the boy Epi. Epi. So I was wondering, what is Epi? So he explained the meaning of the name. Now, after he explained the meaning of the name, he now told me that the boy was going to preparing to study medicine. So today, under career counseling, I'm going to talk to you about what it takes for you to study medicine anywhere in the world. And we are starting right now. Welcome back. My name is Olugbenga Adetitun, and I'm your host on this YouTube channel called Olugbenga Adetitun YouTube channel. Please take out time to look at my other videos, click the subscription button, click the notification button, and share the video and like and comment. Now, I'm talking about what it takes to study medicine. Medicine is a course that will almost be relevant at all times. Medicine will always be relevant at all times. Statistics has it that in the United States of America, which is perhaps the most developed country in the world, or one of the most developed countries in the world, at least by the time if it's not the number one, by the time you count 1, 2, 3, 4, 5, you are sure to count the United States of America. Definitely, the United States of America is the world power today. Statistics in the United States shows that the number of doctors to patients is not sufficient. The number of doctors to patients is not sufficient. If that can happen in the United States, you can imagine what is happening in other countries of the world. You can imagine what is happening in Ghana. You can imagine what is happening in Cameroon. You can imagine what is happening in China and India. You can imagine if they have sufficient medical personnel to cater and to cover the population, even in Japan and in countries like France and Germany. Now, there's a ratio of doctor to patient. And by the time you look at the number of doctors they have and the population, that is how they arrive at the ratio. In the United States, the ratio is not being fulfilled. You can imagine what the ratio will be in Nigeria. And that is why what I'm saying is that we need more doctors. We need more doctors. More doctors are needed. There are some talks sometimes that says doctors don't get job in Nigeria. They get job in a government hospital. You need connection. If you study medicine and surgery in Nigeria, you can relocate to the United States. You can relocate to Britain. You can relocate to Scotland. You can relocate to other advanced countries of the world where the opportunities are there for doctors if there are no opportunities in your own country. But actually there are opportunities because private hospitals also have a huge chunk of the number of doctors that are being produced by our university. Recently, I happened to use a private hospital, and recently I knew some of the doctors over time as I've been going there. But after 1 year or so, you discover that a particular doctor has left. So you ask, where has he gone? He has gone to teaching hospital. We belong to the federal government. He has gone for his residency. He has gone to become a consultant, to prepare to become a consultant. And some have gone to seek greener pastures in other hospitals and other places. Now, what I'm saying is that there is what is called mobility of labor. So don't be dejected and don't let anybody to tell you that medicine is a course that is not selling. It's still selling like hotcake today. Now, let me go straight to the business. What does it take to be a medical doctor? Number one, in your secondary school, I'm looking at the academic qualification. I'm not looking at the personal characteristics now. Because sometimes we dwell much more on the personal characteristics, and then we leave out the qualification. In fact, sometimes some people say doctors, they took an oath of allegiance that under whatever situation, circumstance, they are going to do this, they are going to do that, they are going to attend to patients. But if the doctor is attending to patients every time free of charge, that means his own family will not feed. That means he will not be able to cater for his own needs. And if you see a doctor that is just is patching his trouser, is patching his shirt, and is going around the street with his leg with slippers, and is coming to treat you, you imagine what kind of doctor is this? You yourself will imagine that what kind of doctor is this doctor? Are you sure this doctor knows what he's doing? So doctors need to be paid and paid properly. Now, if you want to study medicine in your senior secondary school, you should take courses in the sciences. Take biology, very importantly. Take agricultural science, very importantly. Take chemistry, very importantly. Take physics, very good, very important. And take mathematics and English language, very, very important. Now, by the time you write the terminal exam in the secondary school that end the secondary school, which sometimes in some countries is handled by external body outside of the school, you take the terminal exam. The terminal exams usually we ask you questions from year 1 to year 3 of the senior secondary school classes. When these questions are set and you answer them and you pass, then you qualify to go to the university of your choice to study medicine. In Nigeria and some African countries and some countries of the world, you can finish your secondary school like that, your high school or your post-primary school, complete it, and then you proceed directly to study medicine in the university from year 1, from high school directly to medicine, from secondary school directly to go and study medicine in the university, from post-primary school directly to go and study medicine in the university. Now, if you go to the university that way and you gain admission to the university, you are going to be in the university for 6 years studying medicine. In the year 1, you'll be drilled on some courses in the sciences and some general courses, even mathematics and physics. In year 2, you focus more on your core, which is physiology, anatomy, integrated paper, and some other things that are added. Now, after you've done this, in your year 3, you're going to do what is called the MB. That is usually the borderline between the preclinicals and the clinical. The preclinicals is the years that come before the clinical. In the clinical, you have gone to the clinic. You have moved to the clinic. They'll be taking you directly, be seeing the patient. As they're telling you about the medicine, no more abstract, they'll be showing you also the patients that are affected by whatever ailment they're trying to address at that particular time. So after the clinical, after the preclinical, you write an exam which is called MB. It's a tough exam. You write it, you must have average of 50 in all the papers, or 55 or 60, as the case may be, in all the 4 papers that you write or thereabout. After you've done this, then you move to the clinicals. Your year 1 in the clinical, that's the 4th year in the medical school. Year 2 in the clinical, that's the 2nd year in the medical, in the clinical, which is the 5th year in the medical school. And then you have the 6th year in the medical school, which is the 3rd year in the clinic. During this time, you'll be taking around all the departments in the under medicine, all the departments will be taken around. Different professionals and consultants will be taking you with the assistance of other capable hands. They will take you through to make sure that you are grounded. And then you'll be doing a lot of practical also. You'll be on shift, they will drill you. What the life of a medical doctor is, you are going to be shown right there and then to prepare you for that. After you've done this, then you write your final exam. In between all this, you'll be writing exams, you'll be writing different exams over time. By the time you stay through the 6th year, you write the final exam, you stay through. Then you are awarded the certificate of MBBS, Bachelors of Medicine and Bachelors of Surgery. After you've done that, then the next 1 year, you go for what is called housemanship. You go for what is called housemanship. During this housemanship, you are attached to an hospital. You are attached to an hospital. And usually it's preferable that you are attached to a teaching hospital or to general hospital where you have several cases of patients being brought so that you can learn, as well as you are also adding value by also seeing patients. So you get to that stage of housemanship for 1 year and you will be paid some amount of money that is very good. After the housemanship, you have completed and you are ready to go to the world as a medical doctor. So after the housemanship, you move out, you get out, and then you seek for employment. You can be retained in the place of housemanship, or you can seek for placement elsewhere, whether in the general hospital, government hospital, or private hospital. You can also seek for placement outside of your country. Outside of your country, you can seek for placement in advanced country, and you get there. Sometimes they just absorb it directly. Sometimes you do 1 or 2 exams, and then you are good to go. Now, if you are in advanced countries such as United States of America, you do not go straight to study medicine from your high school. You have to do a degree in the life sciences first before you go to medical school. Whether you want to do dentistry, you want to do whatever aspect of medicine, you must do a degree first in the life sciences. Degree such as microbiology or other degree courses in the life science. It is after this degree that you apply to study medicine in advanced countries, and then you are taken to the medical school, and then you stay through, you roll through. In Nigeria and developing countries also, they have flexibilities or similarities in their admission processes and requirements, but they are not too far from each other, one another. Now, the in some universities here in Africa, you can do a first degree in the life sciences like microbiology, biochemistry, anatomy, physiology, and others, and then you'll be allowed to come into medical school to study medicine as a direct entry student. So instead of you to start from 100 level, you start from 200 level. You start from 200 level. I believe I've covered what it takes. I believe I've covered what it takes for you to study to become a medical doctor. My name again is Kubenga Adetiton. If there are other ways I've not covered, ask me in the question format in the comment section below, and I'm going to answer, and that may even prompt my next YouTube video what it is going to be about. By the way, I have a blog called thenewkokoro.com. thenewkokoro.com. thenewkokoro.com is a blog that I have, and there are some talks on campus gist, celebrity gist, and things that are applicable to you. There are also talks on scholarships on that blog. There are a lot of tips on scholarships on that blog. You can get to that blog and you are going to be thankful for it. I'm going to talk to you some other time, but before I go, I want to plead with you that you should watch my other YouTube videos. That is one, watch my other YouTube videos. Click the subscription button. It's just right below. Click the subscription button. Then click notification button. There's a bell, and then when the bell comes up, you click it, and you click all the videos so that any video I produce, you are going to it will be sent to your email that I've produced the video, be notified. Then comment, then like this video. Also share this video. Share it on Facebook, share it on Twitter, share it on Telegram, share it on WhatsApp, Instagram, share it in all the social media that you have. Share it in group discussion group, share it among your contacts, among your group. That is what you can do to repay me for making this video. By the time you share it, more people get to know, and it makes it more popular and it makes it to have wider reach. I'm very happy to talk to you today, and I believe I'm going to see you tomorrow as a medical doctor. Rise up, you and me. Bye for now.